Hi, we're here, DSM video, talking about other addiction-related disorders. So a lot of these are grouped. I'll tell you what they are really quick. We got opioid, cannabis, hallucinogen, gambling disorder. So I was just going to lump these all into one in other addiction-related disorders. So here we go. We are on number 77. So just scrolling down here until we get to opioid-related disorders. Looks like I scrolled past it a little too fast. Let me see here. 77. What are opioid-related disorders? So, opioids, what are they? That is going to help first. They're exceptionally addictive drugs. Often abuse of opioids will readily lead to addiction. Opioid use often results in serious health problems and can lead to death. They give intense feelings of pleasure, and physical addiction develops quickly as a result. The health problems include brain damage, a weakened immune system, increased risk of HIV and hepatitis because of needle use, and a slow breathing rate. Other symptoms include a desire to continue use even when health decreases, turning to crime to pay for opiates, and excessive sleepiness and weight gain or loss. Treatment begins with detoxification. It includes supervised withdrawal, but is rarely successful without supplementary treatment. Medication is also used by taking prescription opioids and slowly reducing the dosage. A little bit like exposure therapy, but it's a little bit of a drug therapy here in that you're reducing the dosage and weaning them off their addiction. It's known as replacement therapy. Alternative therapies include hypnosis, acupuncture, and herbal usage, but the risks and effects of these treatments are largely unknown. Research is showing that sleep disturbance is frequent amongst opioid-dependent patients. However, the researchers show that it is likely due to comorbidity with ADHD and suicidal risk. They show this because it should not be attributed to methadone maintenance treatment. So here we got 78. So 7, 8. What are cannabis-related disorders? Marijuana contains a psychoactive drug known as THC, which produces a high in users. This, coupled with widespread belief that cannabis use is not dangerous, often leads to experimentation and can lead to addiction. Cannabis dependence is the compulsive need to use the drug as a way of self-medicating other problems. Regular users often show symptoms similar to regular tobacco smokers, including respiratory diseases. Studies show that repeated use impacts critical skills related to paying attention, memory, and learning. Treatment is similar to other addiction treatment options, with the primary goal to be abstinence of the drug. This can range from inpatient hospitalization to drug rehab centers to a number of outpatient programs. Research shows that there is a significant association between continued cannabis use and other forms of psychosis. Some form of psychosis, but this was only shown in those who met the criteria of abuse and dependence, not just recreational use. It is clear that cannabis use does have more danger than I certainly first anticipated, and should really be considered before just being used lightly. Moving on, 79. Hallucinogen-related disorders. What are they? Hallucinogens have been used for really surprisingly a long time. In fact, as long as civilization has been around, so have hallucinogens, and of course the abuse of them that follows. These are known today commonly as LSD, ecstasy, etc. These drugs bind with receptors in the brain, and there's an increase in serotonin freely moving throughout the brain, resulting in a distortion of the five senses, perception of space and time, and fluctuating mood. They are in fact minimally addictive, and there are no withdrawal symptoms when usage stops. They do not often reproduce incapacitating physical side effects. They don't cause memory loss readily with limited use, and they give the user a sense of increased creativity and even empathy. However, hallucinogens have been known to cause paranoia, long-term memory loss, with extended use and personality changes, especially in the presence of a hidden psychiatric disorder. Research shows that treatment, including psychotherapy after drug use, has stopped, is effective, including 12-step programs and other group therapy. It is often unlikely that underlying psychosis and other disorders need. It is often likely that underlying psychosis and other disorders need to be addressed. So here we go. 80. Pathological. What is gambling disorder? Pathological gambling disorder is said to occur when a person feels the compulsive need to gamble. That it has a severely negative impact on their work, relationships, and mental health. People with this disorder may throw all their money away or even commit crimes to get money to continue gambling. It is an addiction comparable to that of drugs and alcohol. The disorder is reinforced more by the emotional high or the excitement of the risk than that of the actual money itself. Patients with gambling disorder are likely to develop histrionic, narcissistic, or borderline personality disorder. Treatment of pathological gambling disorder includes psychodynamic psychotherapy that works to expose any psychological factors that trigger the need to gamble. Aversion therapy has also been shown by research to be successful in treating, but they've shown that it is more effective with patients who already have some insight into their situation, insight into their own lives, but are highly motivated to escape it. It is less effective for those less educated about their affliction and is resistant to behavior modification. So that's all for other related addiction disorders. Thanks for watching. This has been DSM Video, and we'll see you next time.